Hello, എല്ലാവർക്കും എൻ്റെ പുതിയൊരു വീഡിയോയിലേക്ക് സ്വാഗതം. ഇന്നത്തെ എൻ്റെ ടോപ്പിക് ഇലക്ട്രോകൺവൾസീവ് തെറാപ്പി or ECT. ECT is one of the treatment used to treat psychiatric problems. Before going to details of ECT, I would like to discuss some points regarding physical therapies or somatic therapies used in psychiatry. So, physical therapies or somatic treatment are some of the physical means of intervention used to treat behavioral problems. Most common form of physical therapies are psychopharmacology. That means all types of medications, drugs used in psychiatry such as antipsychotic, anti-anxiety, mood stabilizers, anti-Parkinsonism, etc. Electroconvulsive therapy, we will discuss about ECT in detail. Repeated transcranial magnetic stimulation, vagus nerve stimulation, deep brain stimulation, psychosurgery. Let's discuss repetitive transcranial magnetic stimulation, in which a magnetic field is created above the scalp of the patient. This magnetic field generates electric impulses, and these electric impulses controls neural activities of the brain. So, because of this transcranial magnetic stimulation, we can treat some of the psychiatric problems which are resistant to medications. Next one is psychosurgery. It is neurosurgical methods to treat psychiatric disorder which are resistant to medications. In psychosurgery, some part of limbic system are surgically removed to treat behavioral problems. Most common types of psychosurgeries are anterior cingulotomy, subcaudate tractotomy, anterior capsulotomy, amygdalotomy. Next one is vagus nerve stimulation. In vagus nerve stimulation, a electrode is implanted into the vagus nerve and it is connected to the pulse generator which is implanted under the chest wall. This pulse generator stimulates the electrodes and electrodes stimulate vagus nerve. Vagus nerve again stimulate various brain activities or control the neural activities of the brain. Next one is deep brain stimulation. Deep brain stimulation is same as vagus nerve stimulation, in which electrodes are implanted in the different parts of the brain and it is connected to the pulse generator, and these electrodes stimulate various brain parts and control the neural activities of the brain. So let's move in details about ECT. ECT is a type of somatic treatment first introduced by Lucino Binni and Ugo Sarletti in April 1938. From 1980 onward, ECT is being considered as unique psychiatric treatment. Let's see definition of ECT. ECT is a type of somatic treatment in which electric current is applied to the brain through electrodes placed on the temples of the patient. The passage of electric stimulus of 70 to 120 volt to the brain for 0.7 to 1.5 seconds to produce grand mal seizures. Let's see which are the mechanism of action of ECT. Exact mechanism of action is unknown. There are various hypotheses saying that ECT affects the catecholamine pathway and limbic system of the brain. It also affects the neurotransmitters such as dopamine, acetylcholine, serotonin, norepinephrine and GABA. It affects the neuroendocrine system and hypothalamic pituitary adrenal axis, so it can action on hormonal secretions of the brain. It affects the blood-brain barrier, immune reaction, oxygenation and metabolism of brain. Okay, which are the types of ECT? According to use of anesthetic drugs, there are two types of direct ECT and modified ECT. In direct ECT, there is no premedication is used, and modified ECT, premedications are used. Direct ECT is given in the absence of anesthesia and muscle relaxant. This is not commonly used method nowadays. In modified ECT, a drug-induced muscle relaxation, general anesthesia and oxygenation is given. The anesthetic agents thiopental sodium 3 to 5 mg per kg body weight and muscle relaxant succinylcholine 1 mg per kg body weight is given before the ECT. Anticholinergic drug atropine 0.3 to 0.6 mg is given half an hour before ECT to control the secretions. According to the placement of electrodes, there are bilateral ECT and unilateral ECT. In bilateral ECT, Electrodes are applied in both sides of the brain, and in unilateral ECT, the electrodes are placed in only one side of the brain. The site of placement of electrode included 2 to 4 cm above the midpoint of line joining the tragus of ear and lateral canthus of eye in case of bitemporal ECT. These are the pictures of placement of electrodes. First picture shows the bitemporal ECT, and second picture right unilateral ECT, and the third picture is the bifrontal ECT. In unilateral ECT, electrodes are placed only one side of the head, usually in non-dominant side, that is right side of the head in right-handed individual. Unilateral ECT is safer with fewer side effects compared to bilateral ECT. According to the flow of electricity, there are sine wave ECT, brief pulse ECT, and ultra brief pulse ECT. In sine wave ECT, there is continuous flow of electricity in two alternative directions with the pulse width of 8.3 millisecond. And in brief pulse, there will be a brief interrupted period of flow of electricity with the pulse width of 0.5 to 1.5 millisecond. In ultra brief pulse, much shorter pulse width is used, that is less than 0.5 millisecond. Sine wave ECT is having more side effect comparing to brief pulse and ultra brief pulse ECT. Okay, now let's see the parameters of electric current applied. According to American Psychiatric Association, the standard dose of electric voltage is 70 to 120 volt, and in duration 0.57 to 1.5 second. Frequency and total number of ECT. Usually ECT can be given 3 times per week. Up to 10 to 25 ECT may be given according to patient condition. For mania patient, more than 20 times of ECT may be needed. For depression, usually 6 to 12 times ECT treatment may be needed. And catatonic schizophrenia, 3 to 5 times ECT is indicated. The production of grand mal seizures is necessary for direct and modified ECT. In direct ECT, the tonic phase, that is muscle contraction, is lasts 10 to 15 seconds approximately. The clonic phase, we can observe movement and convulsion that lasts for 30 to 60 seconds. Then patient goes into relaxation phase. During the ECT, the physician can monitor ECG also. In modified ECT, mild grimace or blepharospasm, that is a tonic spasm of eyelid, is observed when current is applied. There is also a slow plantar flexion during tonic phase, and there is fine movement of toes can be observed during clonic phase, which may last for 10 to 20 seconds. Okay, what is a seizure threshold? Seizure threshold means a minimum voltage required to produce seizure in a particular patient. It will be different for different patient. If the seizure threshold of a patient is high, we need higher voltage to produce seizure in that patient. The stimulus voltage is calculated based on the seizure threshold. Usually 1.5 to 3 times of seizure threshold voltage is required to a particular patient to produce seizure in that patient. The seizure threshold is dependent on the age, gender, medication, previous ECT of the patient. Also, during the administration of ECT, we should monitor heart rate, BP, ECG, and oxygen saturation of the patient. Now let's see which are the indications of ECT. ECT can be given to a patient with major depression, with high suicidal risk, severe catatonia, manic patient, patient with severe psychosis, postpartum psychosis, previous depressive episode, paranoid delusion, anorexia, early morning insomnia, and lack of concentration. ECT is also preferred for patients with cardiac disease and pregnant women. For cardiac disease, antidepressants such as tricyclic antidepressants are contraindicated because of dysarrhythmia and congestive heart failure. For pregnant women, antidepressant place the fetus at risk for congenital defect. So, ECT may be preferred than antidepressant in these patients. Which are the contraindications of ECT? A increased ICP or intracranial pressure is the absolute contraindication for ECT. The relative contraindications are cerebral aneurysm, cerebral hemorrhage, brain tumor, acute myocardial infarction, congestive heart failure, pneumonia or aortic aneurysm, retinal detachment, cerebrovascular accident, hypertension, thrombophlebitis, and bleeding disorders. Side effect of ECT. The main side effects are memory impairment, drowsiness, confusion, restlessness, poor concentration, anxiety, headache, weakness and fatigue, backache, muscle ache, dryness of mouth, palpitation, nausea, vomiting, unsteady gait, tongue bite, and incontinence. Complications of ECT. For direct ECT, there will be chance for fracture and dislocation. Modified ECT, because of use of anesthetic agents, respiratory complications can occur. Also, other complications such as cardiac dysarrhythmias, long-term memory loss are some of the complications of ECT. The ECT team include psychiatrists, anesthetists, trained nurse, ECT technician, and other helping aides. Preparation and facilities for ECT include a pleasant, comfortable pre-ECT room is needed. In the ECT room, it should be equipped with ECT machine and accessories, anesthetic appliance, suction apparatus, face masks, oxygen cylinders, and oxygen supply, tongue depressor, mouth guard, bite block to prevent tongue bite, BP cuff, pulse oximeter, resuscitation apparatus, emergency drugs, and there should be immediate access to defibrillator if any complication arises during the time of ECT, and a well-equipped recovery room is needed to observe the patient after the ECT. And this is just a schematic representation of process of ECT. After final checkup, pre-medication is given to the patient and patient is shifted to ECT room. ECT is applied, then patient is shifted to recovery room. Now let's discuss care of the patient undergoing ECT. The care of the patient undergoing ECT can be described under three headings: pre-treatment evaluation, intra-procedure care, and post-procedure care. Okay, let's see which are the pre-treatment evaluation of patient undergoing ECT. A detailed medical and psychiatric history of patient should be taken. Also take the history of allergy to any anesthetic agents. Assess the patient and family's knowledge regarding the ECT and all information regarding the side effect, therapeutic effect and risk factor associated with the ECT should be given to patient and family. Informed consent should be taken to remove fears and anxiety of patient regarding the procedure and assess the vital signs of the patient. Patient should be empty stomach for 4 to 6 hours before the ECT. Withhold night dose of drugs such as diazepam, barbiturate, and anticonvulsant, which may increase the seizure threshold in patient. Also, withhold oral medications in the morning. Head shampooing should be done to remove all oils from the hairs because oil causes impedance of passage of electricity to the brain. And all jewelry, prosthesis, dentures, contact lens, metallic objects, tight clothing should be removed from the patient body. Patient should empty the bowel and bladder just before the ECT and half an hour before the ECT. Anticholinergic such as atropine 0.6 mg IM should be given to control the secretion during the ECT. Intra-procedure care of the patient with ECT include place the patient comfortably in ECT table in supine position. Always stay with the patient to allay anxiety and fear. Administer anesthetic agents thiopentone sodium and muscle relaxant succinylcholine just before giving the ECT. Since the muscle relaxant paralyzes all muscles including respiratory muscle, patient airway should be ensured. Ventilatory support should be given to the patient. A mouth guard or bite block should be given to prevent tongue bite during the ECT. The site where electrodes are placed should be cleaned with normal saline or 25% bicarbonate solution, and a conducting gel should be applied to facilitate the flow of electric current. And this electrode is connected to the ECT machine and set voltage, intensity and duration of electric stimulus in the ECT machine and delivered the electric shock. And after delivering the electric shock, we should monitor seizure activity using cuff methods. Cuff methods means just before giving IV anesthesia, we should bind a BP cuff on patient right hand, which prevent the flow of anesthetic agents in that particular hand. And during the seizure activity, we can monitor movement of fingers in that particular hand. It is called the cuff methods. And 100% oxygen should be given to the patient, and monitor vital signs, ECG and oxygen saturation during the ECT. After the ECT, record all findings and medication given to the patient. The post-procedure care include monitor the vital signs, continue the oxygenation till spontaneous respiration occurs in patient, assess for side effects such as confusion and restlessness in patient. Patient may be disoriented, so safety precaution should be taken to prevent injury. A side-lying position and suctioning should be given to prevent aspiration of secretion. Side rail should be given to the bed to prevent falls from bed. If there is severe confusion and restlessness, IV diazepam may be administered. Reorient the patient after recovery and stay with the patient till patient fully oriented. And finally, document the findings. Okay, these all are about my class ECT. Hope all of you understand regarding the ECT. Thank you so much.